Thank you, Mr. Chairman.
Thank you. I'm going to go to Dr. Harris, but I just want to, because this area, the Mentally Ill Offender Treatment and Crime Reduction Act was bipartisan approach to better addressing with mental illness the criminal justice system. It's been around for 10 years, gets little support, quite frankly, from the administration. And unfortunately, though, the administration's budget proposes that funding for the Mentally Ill Offender Treatment and Crime Reduction Act be eliminated and instead combined into a drug and mental health courts program, which would effectively exclude 60% of the key elements of the program. So I think the administration has taken a wrong position to propose the consolidation. I'd ask you to kind of think about that as we work through this budget. Dr. Harris?
Thank you very much, Mr. Chairman, and thank you, Mr. Secretary, for being here with us today. Let me follow up a little bit on what the chairman and of the subcommittee and committee both mentioned, basically controlled substance abuse, and particularly about the enforcement of the Controlled Substance Act. Obviously, a decision was made in the Department of Justice not to enforce the Controlled Substance Act broadly in states that have legalized recreational marijuana. So I'm just going to ask, where was the medical expertise that you used in making that decision? I mean, I assume you didn't spread that decision to other Control 1 drugs, Quaalude, mescaline, ecstasy, heroin. So was there a medical decision-making process into selecting that drug for selective enforcement, that Schedule 1 drug?
Well, what I'd say is first that we still enforce the Controlled Substances Act. What we made was a law enforcement decision.
Right, that's right. So making that law enforcement decision to pick out one Schedule 1 drug as opposed to the other ones, was there medical input into that? It's just a simple question. Do you have medical input within the department?
What we made was a law enforcement decision as to how we were going to use the limited resources that we have.
Well, then, thank you. So, I'm going to urge that you take up the chairman of the subcommittee's offer to sit down and meet. Dr. Volkow testifying in front of this subcommittee, the director of the National Institute on Drug Abuse calls marijuana part of a complex and evolving public health threat. I don't know, Mr. Secretary, if you're aware, but if you talk about teenagers, 15.6, 1 in 6 teenagers has used marijuana in the last month. Only 9.6% have used tobacco. If you look at 12th graders, 6.5% use marijuana every day. Only 2.2% use alcohol every day. Wow, that's a public health threat. And, the importance of signals can't be underestimated. So I'm going to ask you, do you agree with the President that marijuana is less dangerous than alcohol?
Well, I think the President's remarks in that regard are taken a little out of context. You have to read the entirety of what...
Sure, let me read the rest of it. He said marijuana is less dangerous than alcohol in terms of its input on the individual consumer. Do you agree with that?
Well, as I said, if you have to keep reading what the President said, and he...
That's what he said, Mr. Secretary. I'm quoting what he said.
Can we let the witness answer the question, Dr. Harris?
If you want to yield me some of your time, I would be more than happy to.
I'd be glad to yield you time. If for any of your questions, just allow him to answer.
Then I will take you up on that offer later to yield me the time to finish my questions. Thank you. Mr. Secretary, go ahead, because I thought I read it in the context in which he said it.
There were further remarks, which I don't have in front of me, that were a part of that same interaction. I guess he had with a reporter, or a TV reporter, I'm not sure exactly who it was.
New Yorker. Yeah, New Yorker magazine.
He talked about how the use of marijuana was not a good thing. It was something that he's not advocating for. So in that regard, I think the President had it right. We look at the limited federal enforcement resources that we have. We try to make determinations about how we can most effectively deal with them. We set out a series of 8 factors that indicated how we would look at our marijuana enforcement efforts around the country. And we focus on things like preventing the distribution of marijuana to minors. That is one of the 8 factors that we take into consideration.
Thank you. And the administrator of the DEA testified that there were those 8 factors. So I'm just going to ask you again, do you agree with the President, or do you agree with the director of the National Institute of Drug Abuse that marijuana is, quote, part of a complex and involving public health threat? Do you just agree with that statement? It's not a complicated question. Do you agree that it's part of a complex and evolving public health threat?
I think that what we have done, the way in which we are looking at those laws in Washington and in Colorado, the enforcement priorities that we have set out, I think that what we are doing makes a great deal of sense and is a good use of the enforcement resources that we have. And I think it's consistent with the general approach that we have taken with regard to our narcotics enforcement efforts.
Okay, so I take it you won't answer the question. I can't blame you, because it would be all over the press tomorrow, what the Attorney General's opinion is on the danger of marijuana.